Hey y'all, it's Alicia and welcome back to another episode of the E to Me podcast. Y'all, I'm so excited because I have Dr. Nashira Kayode here on the podcast. I got it right. I was excited.
Yes.
We were laughing earlier
I
because
know that's a tricky one.
we were laughing earlier because I was talking about how my accent is, sometimes you can hear that country twang in there. And I was making sure I was saying her last name right. It's Kayode, but I know me and how my actual accent goes. It'd have been Coyote, something like that. So I'm glad I got it right. So thank you so much, Dr. Nashira Kayode, for being here on the podcast. I'm
Thank
just so
you.
excited you're here. Thank you.
I'm so excited that you invited me here.
Oh, you are welcome. So should I call you Dr. Kayode?
Yes, or Dr. Shy, whatever you're comfortable with. I'm not
All
picky.
right. Like I said, thank you for being here. And one thing I always ask people, especially when it's like something that's around their profession, I'm just curious, how did you get started in the mental health world? Like what brought this about in terms of you wanting to be working with those that are dealing with mental health?
So for me, it was kind of a journey. I originally wanted to be a lawyer, and I actually started my undergrad, going towards law. But I got married, I had my first child, and it was like law school just wasn't really in the mix of things. And my mom was actually getting her master's in social work, and she sold me on, well, why don't you come do this? You'll probably like it, and you can go to law school later. And so I started it and I just loved it. I pretty much have always liked the idea of, why do people do what they do? That was kind of the angle that I liked in law anyway, kind of that psychology piece of, what makes people do the things they do. So it kind of fit right in. And after that, it became my passion. I knew I always wanted to do something that would, be beneficial to the community. I didn't want to spend 40 hours a week doing something that I didn't feel was meaningful. This definitely worked and checked off all the boxes.
I love that. And it's just so interesting because I'm a nurse practitioner. And so on top of me
Okay.
being an actor, like I'm all over the place.
Wow.
But but I love when I hear that, like your calling was to like figure out how people operate and what makes them tick and all these different things. I'm on the other spectrum of that. I mean, I like to know those kind of things, and I think, but at the same time, it's like the mental health component for me sometimes is a bit tricky, right? But at the same time, as
Yes.
I want to raise awareness around mental health, do you find that even in your, maybe not in your profession, but just in general, when you're working with other providers, that they're kind of like a little like backed off when it comes to like addressing mental health things? Is that a thing?
Yes,
Yes.
absolutely it is. Absolutely. I've worked in kind of like medical type situations, and I've even have certain people, even doctors say, like we don't do that. And I'm like, okay, like,
Right.
well, somebody needs to. And I think it is that gray area. Like you
Hmm.
said, a lot of times we're trying to apply a medical model to mental health. And
Yes.
because mental health is so gray, because it hasn't, it's still new as far as really being evidence-based and research and things like that. And then when you throw in communities that usually aren't part of that research and things like that, it gets even more gray. So I think that's, kind of what kind of scares people, is that, mental health is very much kind of it can be a gray area.
Yeah, and thank you for pointing that out because that is literally what it is for me. It's I want something to like kind of like fall in place. Like, okay, if you are diagnosed with this, okay, I'll prescribe that, right? And the hope
Yeah.
is that that particular treatment will work, and that's not always the case in mental health.
Yes, exactly.
And so
Yes.
that's very scary to me.
Yeah. Just
Seriously.
like just the diagnosing part sometimes is not very clear cut.
Right.
So yeah,
And
that
and
definitely will affect how the treatment goes.
And so that leads me into like asking or just really just trying to dive into this whole idea of trauma, right? Because I think that is something that could be misdiagnosed to some degree, correct?
Yes, absolutely. So there are specific diagnoses related to trauma. One of the most significant ones is like the post-traumatic stress disorder, PTSD.
Right.
I think everyone's heard, PSD loosely or professionally in some way. But, that is a real actual mental health diagnosis. That's something that, we would treat in therapy, perhaps medication with the psychiatrist. But it's definitely a huge part of mental health. And I've worked with very severe mental health cases.
Mhm.
And I was just telling someone else a few days ago that I've probably seen thousands of severely mental ill cases. And I can't think of a single one where they had not had trauma at
Wow.
some point in their life. So, of course, it's always, what came first, the chicken or the egg?
Right.
Or, is it social factors or, biology, is it genetic or what have you? But there's definitely a relationship between trauma and, our emotions, our feelings, and our mental health. Absolutely.
Yeah. And I guess for me too, it's like the everyday person, right? That's just out here dealing with certain things and maybe have like, I guess you could say there's symptoms that they're not even aware could be in relation to traumatic events that have happened in their life. Like for instance, like certain
Yes.
people are like kind of like a little anxiety ridden, right? Like they have a lot of anxiety or whatever. Or they're very, kind of like just kind of like negative in a way. And it's like, well, that's just who I am. Could that be something that's also like related to like a traumatic situation that is causing them to feel like that's just a characteristic of who they are and they can't, and there's no, how can I say this? Like, it's like, that's who I am, right? There's no fixing that because that's just who I am. Could that be something that's like traumatically involved in?
Absolutely.
Yeah. Okay.
Absolutely. Trauma can definitely affect, who you are essentially.
Mm.
And if that trauma was, early or in childhood, it very much it affects your outlook on life. It affects how you interpret information. It affects how you put it, it affects everything. And I think that's interesting that you say that people don't even recognize everyday trauma. And I've actually had, clients and patients that, that's part of every assessment. Have you ever, suffered any trauma? So, sometimes we term it like that. I always try to term it as, have you experienced anything that affected you negatively or you feel like was a big stressor in your life? And I'm always amazed at how many people will say no.
Wow.
And then, we go on and we talk about more things. And I've had extreme situations where people will tell me, no, there was no trauma. Then later, as we're going through the assessment and the story, they'll say how they were taken from their parents and put in foster care at 14 for child abuse. And I'm
Wow.
like,
Whoa,
what
whoa,
do you
whoa.
mean that was not trauma? Like, I've seen people have huge, obvious things and they still will say no. And
Mm.
oftentimes I've noticed that it's, marginalized groups, it's people of color, it's, people that, Black and brown people. And I think it's part of, that we're just kind of so used to some things in life that we don't even see them as trauma or, like no. And that can be true for anyone.
Right.
But I think especially because we tend to not, we're not always open to mental health. We're not always
Right.
open to therapy. So, we don't hear these things and learn these things. So we automatically just, we overcome, right? We
Right.
overcome, we persevere, we make it through somehow, some way, but we're not realizing like, no, that was like actual trauma. That was not okay. That shouldn't have happened. I was watching a special on TV and another African American therapist was saying she's had clients tell her, no, there hasn't been trauma, and then discuss how they've been shot before.
Wow.
And they would still say, I haven't had any trauma. So absolutely the kind of smaller everyday things, we absolutely are not recognizing how much of an impact they are because I've seen how people are not even recognizing the huge things that have
Mhm.
occurred in their life.
Right. That is so interesting to me because I just feel like you said, in marginalized groups, particularly like, and I'm thinking because I'm a Black person, I feel like a lot growing up when there were things that would happen. And let me know if this is something that's like you've seen because I'm pretty sure this is something, but like growing up, if something traumatic would happen in our lives, like say within our family, it was a thing we kind of like acknowledged it. I'm saying this in air quotes. And then it was a thing of, okay, we got to move on. We don't have time to
Yes.
deal with this because life is still lifing. You know what I'm saying? And so I'm wondering, particularly with like older people, like older Black and brown people, what does that look like for them to like really acknowledge that moving on, I mean, you have to move on eventually, but to still take in that sense of this was something that was bad that happened to you, and it's okay
Yes.
for you to have these feelings around it. Because I feel like, at least in my family, a lot of the older people is like, well, that happened. That's just life and whatever, right?
Yes, absolutely.
How does that kind of like help? How do we help them in that regard? You know what I'm saying?
I think a lot of what we're doing, people like you inviting me on this podcast, we're putting it out there.
Right.
It's really just, educating our community
Mhm.
and everyone educating each other and continuing to do so,
Right.
as we learn new skills, as we get more information, we have to persevere through some of that, not acknowledging, that's just going to be something that we have to, persevere and work through
Right.
and things like that. And I've experienced some of that myself, like with my own father. He's, 67.
Mhm.
I'm blessed that, I can say I had, pretty much a pretty great childhood and things like that. And, my parents did a really good job of making sure they deviated from traumatic things and
Mhm.
things like that. But my dad, still to this day, he has things that he hasn't resolved. And I'm like, Dad, like that was really bad.
Right. Right.
And you're 67, so we're going to talk about it still. But
Right.
it doesn't leave, and
Right.
it's like, no, we're not going to continue to perpetuate that certain things are okay or certain things happened. And that's kind of just the way it was. It's never too late to address those things. It's never too late to make peace with certain things. It's never too late to you know emotionally grow and be okay with certain things. And sometimes we have to, sometimes
Right.
it's survival. You have to make it through that trauma. And while you're going through it is usually never the time to, oh, what do I think about that? How
Mhm.
do I feel? You're just trying to survive
Right.
and make it through that. So that's normal, that's acceptable. But usually you need to, in order to really heal and become whole, you're going to have to revisit that,
Right.
at some point when it is safe, when, the coast is clear, when you're out of that crisis or that trauma, to revisit it and say, wow, that's how I felt during that. That's how I felt. This happened to me, or I experienced this. And I think that's the first step in really healing is even just taking that moment back to acknowledge those things, to accept that and be willing to move forward with processing it.
Wow. And it's so wild because I'm also thinking about when someone does eventually come to the point where they're like, what, I want to address the traumas in my life, right? Whatever that looks like. What type of therapies are needed? Or are there specific therapies that are needed to deal with trauma-based type of mental health healing?
Yes, there's tons of evidence-based practices and things like that to specifically deal with trauma-based, mental health issues. And we call it like trauma-informed care, which really is supposed to be kind of addressed to everyone, that
Right.
we should always be speaking as a therapist.
Mm.
We're supposed to always be assessing whatever we're seeing in a client or a patient. Could that be from something they experienced?
Mm.
No matter how big or small it is. You know, Oftentimes, people, we can't take things at surface value. So someone who
Right.
comes in angry, why is this person angry? We're
Yeah.
not going to just say, okay, you need to get unangry, stop being angry.
Right.
It's, well, let's go back and see what made you angry. When did you
Mm.
start feeling like this? When did this start? And oftentimes there's so many things that really you can trace back to a specific trauma, a specific situation.
Mm.
I met with a guy recently who was 32, and he was a young Black man, and he had a long criminal history. He had some mental health diagnosis really early on, acting out, as a child. And of course, I asked that question, has anything ever bad happened to you in your trauma? No. But as we go on, he says, he just happens to mention very quickly and very shortly, because
Right.
it's always the thing that they don't, that's not even the thing they show up for, right? And he mentions how his stepdad left when he was 14. And
Wow.
sure enough, you look at everything, you look at all, when did life derail for him? When the stepdad left.
Mm.
And I'm like, and that was traumatic for you. It may just be as simple as, my parents divorced, or someone who was in my life consistently and was an important figure is no longer there. Or,
Mm.
they exited at this point. That's trauma.
Right.
Going from having a certain support system to not. And then sometimes the things that can result in that, like in this situation, this young man started engaging, with gangs and things like that.
Right.
Didn't finish school, but it seems like from all accounts, things were pretty stable and going well up until that point. So then the question becomes, well, how did that situation affect you?
Right.
There's no way that it didn't, because,
Right.
I'm seeing this significant deviation in life for you.
Right.
That was the fork in the road. So
Right.
something, it affected you to some extent, but yeah, it's always there. So it's kind of looking deeper. And I think we are finding that, there's often trauma, and we all experience it, to some extent. Obviously, there's, very severe cases of trauma and things like that and abuse, but, there's everyday things that may just be as simple as a divorce, or maybe a family member dying, but maybe just a natural course of life. But depending on that, how that affects us, it may have a significant impact.
That's just, for me, it's wild to, like, as you were saying that, I was just getting like this message in my head. It's like people could also be feeling like stuck, right? Like it's like that event, and they don't realize that event has caused them to feel stuck. So they're like, okay, I want to get out of this. But I just don't know why I feel so stuck. And does that like present itself as well, like with people that come to you like, I want to do things,
Absolutely.
but it's just like
Yes,
something's like a
absolutely.
barrier right here, right? Like,
Yes, absolutely. And a lot of times they don't know
mm,
where, at what stage they're stuck or
right,
why they're stuck. But yeah, oftentimes, a lot of times, it's not that people don't want to, for example, not be angry,
right.
or something like that. They want to. It's just they really don't know how to.
Mm,
They don't know how to process it, or they don't know how to, move on to the next step. And oftentimes, that's what therapy is just helping you get from point A, where you show up at, and to the next point that you want to be at.
right. Wow. And this is another thing that we had mentioned before. I really wanted to kind of like talk about, and I don't know, we probably don't have time to talk about all the things, but just as it relates to Black women, right?
Yes,
I feel like obviously just being a Black woman in America, it's traumatic.
absolutely.
But I am wondering, what point does this actually present itself as being completely like, I don't know how to say it, like just like harmful for Black and brown women living here in America? And I say it in that way because it's like I don't think we realize a lot of the things that we're trying to protect ourselves from, and we put up these barriers that can be harmful for us in terms of like, propelling to be our better selves, right?
Absolutely.
I don't even know how to like phrase that, if that makes sense. But like,
Absolutely.
it's just like, how do we as Black women just kind of like navigate these waters without harming ourselves in the process?
Yes. So I would say the how is depending on your situation, what
Right.
have you, if you can, therapy, there's lots of self-help things, and stuff like that. I think that's the how. As far as what that actual process entails, so I've done, a little bit of trauma research here and there, and a lot of it is, one, you have to feel safe. So you have to be out of the trauma, out of the crisis. If you're
Right.
still going through it, you can't get over something that you're still going through. So
Right.
one, there has to be, an end. The
Mhm.
trauma has to end, the crisis has to end, and now you can move forward. And then there has to be kind of a reconciliation of that person that experienced those things and who you are now. And that's kind of the, stuck part that you
Yeah.
discussed. So say maybe it's something you experienced as a child. So 5-year-old you could not do certain things, could not protect yourself, could not do A, B, C, and D that needed to be done at this time. But you, as an adult woman, you can do those things and reconciling those things. Sometimes it may be forgiving yourself for making bad decisions. It might be accepting certain things weren't your fault. It could be different things, mean different things for different people, but ultimately reconciling that situation with who you are now. And, accepting and coming to terms with, that it is over, that there was a stop. This is a different situation. You're a different person. And how do we kind of reintegrate those two people? And oftentimes, and you probably can speak to that more as more of the medical person, we forget that we have physiological responses to,
Right.
trauma and things like that. So oftentimes it may include different things that incorporate your body, whether it's breathing or yoga, or something like that. But it's also learning to physiologically turn off, those receptors that keep telling us trauma, scared,
Right.
walls up, this and that. It's really recognizing them and doing, the work mentally and emotionally, but also physically at times. Because sometimes your body is telling you to be on alert when it's not necessary.
Wow. I love that you brought in that whole idea of bringing your former self, to say like you said your 5-year-old self to your adult self. And I've gone through that process. I'm actually still, working through all those things as well.
Mhm.
And I don't know that a lot of people, and maybe they do, maybe it's just me that just now realize all these things, that a lot of our childhood things still they still follow us and they
Absolutely.
shape who we are as adults. And we still kind of, especially in the places where we have experienced a trauma, we still operate as that person at that time
Yeah.
and space, and not
Yes.
realize that that's what we're doing at that time.
Absolutely.
I did not realize that until I started really, diving deep into like my mental health journey as well. It
Mhm.
was like, that's where that came from.
Absolutely. And there's research that shows most of your personality is formed by the age of 4. So a lot of who we are that person very early on.
Right.
Unless, obviously trauma can drastically change, or situations, but a
Right.
lot of your actual personality is formed by the time you're 4. We really are that person. So even, what happened very early on, I've seen trauma with people that, happened before they can even remember it.
Mm.
They might have been 1 or 2 or something like that. And then, they show up as an adult, and then it's like, we can see like, oh no, that, you know, that first year was enough to give you trauma that you're still dealing with it now. You probably don't know, you probably don't even remember it, but
Mm.
it can absolutely still be there. Absolutely.
That is so interesting. And it's funny because as I think about this, growing up, a lot of the adults in my life, I think, and I could be wrong, and a lot of these people can't vouch for themselves because they have passed on, but I really felt like a lot of the adults that I grew up with just thought kids, like you forget everything at some point, all the things that happened to
Yes.
you. Once you're an adult, it's just you're a new person and you just start all over again,
Yes.
right?
And it's so far from the truth. It is so far from the truth. I can't think of anything further from the truth at the moment. That's
Right.
very, very far from the truth. And most people, a lot of people, the trauma, and it may not be drastic, it may not be abuse, it may have been something that you couldn't necessarily control.
Mm.
So, I'll give you an example so as a child, I had a blood disorder really bad and chronically.
Mhm.
It caused me to be sick in the hospital, right? Not something that anyone did to me per se, but it did cause some trauma. And I had to go back as an adult and, kind of deal with that. At some point, it comes back.
Right.
That's the other thing about undealt with trauma. It will come back. You don't step up to deal with it, it will step up to deal with you. It's almost always going to come back. I've seen people in their 60s that still have, hangups or kind of issues over a parent that left them as a
Mm.
child. They're
Right.
in their 60s, and you see it playing out in the relationships. You see it playing out in other areas of their life. And sometimes they'll say little things that they don't even know it.
Mm.
I had an older gentleman. He made a comment about how his daughters bought him clothes. And he said something like, yeah, my mom used to buy me clothes. And, and I'm like, wow,
Mm.
like, But it can be so deep rooted. It can be so there that, time does not necessarily heal all wounds. Time
Wow.
allows us to cover them up. It allows us to forget that
Right.
they're there.
Right.
Allows us to not notice them anymore, but other people do. So like this, gentleman, and his mom hadn't even raised him actually. So he's talking about something that she did for him at, 4 or 5,
Wow.
a very young child, and to be so much older, but it's like that's still a thing. It did not go away. Time, did not magically make that disappear.
Right.
That hurt is still there, that wound is still there. And oftentimes it plays out in life in different ways.
Wow. And it that for me is it's so like eye opening and like refreshing in a way because it's a lot of times you just wonder like why am I this way? Why is this happening?
Yeah.
Why can I break out of whatever? Like I said, the whole feeling stuck. And it's like to know that there it's a possible way to work through it, but it's
Oh
the
yeah,
work
there's actually several with trauma. There's been a lot of research and
Mm,
evidence-based practices on trauma. So there's a lot of stuff out there. There's lots of therapists who are well trained in that area. That's a huge area in therapy. So there's lots of stuff. There's lots of modalities and
uh-huh.
types of different treatment that you can do. Like inner child work is one of the ones that they merge that child to the adult, say if
Mm,
that trauma was in childhood, that particular one is called inner child work. But there's already quite a bit of evidence-based trauma therapy. There's
right.
tons of it out there already. And now with the creation of so many self-help books and things like that, if you're not ready to take that leap into therapy yet, there's still a lot of education and knowledge that you can get there for get for yourself, and at least start implementing some of that.
I love that. And then, so for someone who is actually in a place to say, I want to address my trauma, I want to, seek out, someone that can, work through this with me. What should a person look for? Should they just any therapist, or should they look for some type of credentialing or whatever?
There are some that have been, like have certificates in different trauma work or different modalities. So
Hmm.
there are some like that. But generally, you can just ask any therapist, what's your, experience with this? And you can even be as specific as you want. There are some therapists who specifically work with women that have histories of sex abuse. Or there's people that, there's therapists that specifically work with survivors of child abuse.
Right.
Or, there's quite a bit out there. So especially if you live in, a major city, a major state, you probably, would probably be pretty easy to access someone like that. I know I've seen oftentimes on when you request a therapist, it'll ask you now if
Oh,
you want a man or a woman. It'll
uh-huh.
ask you even if there's a particular race or nationality that are interested in, a specific gender that you're interested in, and then it will ask you, click the different areas that, this is what I want to work on, and it kind of matches you with people that fit in those categories.
Oh, that's really interesting. So it's like if you go on to like something like oh, what's it called? Like Better Help or something like to that
Yes.
effect, right?
Yes.
Oh, wow, that's really interesting.
Yeah, a lot of them are getting very, good and specific at that. Even
Oh,
a lot of the health cares, they at minimum will ask you what type of issue you're coming with, and they'll
right.
try to match you with someone along those lines. And what gender you would prefer that person be, and um, nationality. I've seen them ask that, race. I've seen them ask that quite a bit too.
That's really interesting. I did want to actually ask you. I saw that you work with a lot of men that they were incarcerated. Is that what it is?
Yes.
How did you
Yes.
get into that world? I'm just that's so fascinating to me.
So some of it was by chance, but
Okay.
again, I loved law and everything else. So for me, it was like, great, this is how I can
Right.
kind of mix in the criminal justice and the mental health. And,
Uh,
so for me, I loved it. But my first job was at Metropolitan State Hospital in Los Angeles area.
okay.
And then I worked for Patton State Hospital for quite some time. So the majority of my career was between those two hospitals. They're both forensic. So the people in those hospitals, the majority of them have committed a crime, but either their crime influenced was influenced by their mental health symptoms, or, they've now been convicted. And so they're kind of like doing their time at a state hospital as opposed to prison.
Okay.
So I pretty much just kind of like signed up for it, a long time ago, and, made my way through that. It's a job that a lot of people don't want to do,
Right.
because it's in locked facilities and things like that. So it can be a little scary. So yeah, but I just got into it and I loved it, and, I'm kind of sticking with it. So
And I think that is so beautiful because I think, like you were saying, a lot of people don't want to do that work. I think it's one because it's like, like you said, the sense of like possibly being in danger.
yes.
But I'm wondering though, as working with a lot of people in like facilities like that, the mental health component, would you say like the majority of these people are suffering with some type of trauma or mental health issues or no?
Yes, and I've actually done research on basically who's in our jails here in California. So
Mm,
I actually did research on that, and the numbers are like half, at least 50% have some type of mental health diagnosis or something along those lines.
right.
And often what we see is, if you can imagine, if the people on the outside aren't really paying attention or don't know, if they have trauma, if they have this
Right.
or that. So if you can imagine on the inside, it's even less.
Wow.
So, those numbers are probably much higher than 50%.
Hmm.
But I think that's one of the most significant misperceptions of our criminal justice system, is the idea that, that we're really, that the people in these jails and prisons are, really bad people. We're really getting the bad guys. Not so much. The data shows that we are sweeping up a lot of mental health. A lot of mental health is getting caught up in that system. And the numbers show probably about at least 50%.
Wow. And so I guess for me, hearing that, like basically half of the population is suffering, what type of like assistance is offered, if any? I mean, and maybe it's state by state too. Who knows,
Yes. Yeah. I would say it definitely varies from state to state.
Hmm.
In California, it even varies from county to county.
Wow. Yeah.
California's a big state, so even from county to county, it varies. Los Angeles County, obviously, more resources. They
Right.
have a little bit more money. They have more options for mental health
Right.
care. There's more things in place. There's more things set up. Other counties may be further along to get to that point. They're usually offering something, at least on paper, but the question is, how good is it?
Right.
From my experiences, it all sounds good on paper, right?
Right.
But
But the implementation.
how much of it is actually happening,
Right.
and if it's happening, how well is it being done? Are we just checking a box and saying we did that next,
Right.
type thing? So, um, and then a lot of times, even what we've come up with, is it working?
Mm.
So I think that's a huge piece of it. For me personally, working with kind of that extreme end, people that have severe mental illness, they've had 500 traumas at this point.
Yeah.
And now, it's looking like mental illness. There's, criminal justice history at this point. So, they've been in and out of jail, or they have records,
Right.
or something has happened at this point now. So now, it's a legal situation as well.
Right.
From what I've seen, just oftentimes it's late. It's late in the game
Yeah.
to reach these people.
Mm.
And that a lot of that is why I've kind of started, some of the other work that I do in creating journals and other
Yes.
resources and things like that, was because I'm like, we have to get to people sooner.
Yes.
That the people that I'm meeting, in all honesty, sometimes it's too late. You could come up with the greatest plan for them, the greatest treatment for them, but it's just late in the game. So many things have happened, especially when they're caught up in the legal system. Our legal system's not always forgiving. So yeah, we can make them better, but is that going to put them back in the community? And then you see the generational effect, right?
Right.
So it's okay, we can fix dad who's here, but guess what? Mom and dad's here, but guess who's already out there? Guess who's already in
Right.
our foster care system? Guess who's
Mm.
already here? Guess who's already there? And so now it's like, okay, now we're out of this system and we have to go over that system.
Right.
And are those people getting what they need because they were exposed to this trauma over here?
Right.
And obviously in California, and I know you're in New York, those are the two biggest states that have the most people in jail and prison.
Right.
In fact, I believe California may have more than most states. I think California, New York, and Texas are at the top.
Wow.
And the US as a whole does prison and jail completely different than any other country. No other country even touches the amount of people that are incarcerated that our country does.
Wow.
Not even close.
And so that also, I'm like, wow, I'm like going down this rabbit hole, of course. But like
It's a rabbit hole. It's a rabbit hole.
it is, because I'm just like, okay, are other countries then offering proper supports, or what is
There are other countries. So I actually have a friend who knows social workers that are literally all over the world. She
right?
knows social workers in Australia, Sweden, and a lot of those countries do have better mental health care and
Wow.
systems than we do. So,
Wow.
they're probably preventing a
Right.
lot of this, which, so just side note, a lot of it can be prevented because even the mental health people I see, they're in jail or in the system for crimes of necessity. So
Mm,
I've seen so many that were people, they're homeless. So
yeah.
now they're stealing food.
Yeah.
They're homeless and cold. So now they made a fire. And because they don't have all the mental sense, they did that fire next to a building.
Right.
And now look what happened,
Right.
but it's not like it was intentional or, they're bad people or they were trying
Right.
to do those things. And I've seen tons of those. I've seen
Wow.
way higher number than you really want to see of people that have done very minimal kind of petty crimes
Yeah.
or just crimes of necessity, but they're swept up in the system now. And now it's a criminal situation. So now they're kind of stuck in some ways.
Ugh, that is wild.
Other countries have better mental health. They're paying attention a little bit more.
Mhm.
They're just kind of into wellness more. There's countries that believe in rehabilitation more than we do.
Right.
Even Canada does. So they don't even have the long sentences that we do. You may commit even a really bad crime, but they don't necessarily put you away for the rest of your life like we do here. Yeah.
That's just mind blowing to me. But at the same time, I'm not surprised,
Right.
right? It's just like
Right up their alley, right?
right, it's like, of course. But I definitely appreciate the fact that you have created these journals. I was looking, you had your first, it's called My First Journal. Is that
Yes, my first self-care journal.
self-care journal? Yeah.
Yeah.
Now, is that for anybody? Like anyone can use that, or is that specifically for women?
So that one, I would say it's more for women because it's, pretty and, has colors that women generally like.
Right.
And that one actually came about. I did that one with my niece,
Oh,
who
fun.
is, she'll be 12 this summer. So she kind of is, had some anxiety, about different things. And I told her like, okay, well, we'll do like some self-care stuff and, we'll do this and that. And she's like, okay, well, where are we going to get our hair and nails done? I'm like, no, that's not what I meant. I'm like, no. It really, all of kind of my personal things that I do outside of, the constructs of the system have really been things that I'm like, I see a need for it. And I'm like, okay, I'm going to fill the gap on that need. So
Right.
that was an example of one. But I would say anyone could use it. Really, everything in there is applicable to anyone. I just made it, cute and girly for our young ladies to pick up because I feel that how we talk about women with trauma and things like that. I think we need to start. Everybody needs to start young on the wellness journey and down that road. So I'm like, there's a lot of resources for women, not so many for men. I haven't seen any that were like really tailored to kids. And, even I, tried to make the language a little bit like we literally worked on it together. Like, okay, is this good? Like, like how do kids feel about like the way I wrote this up? Or, does it sound like too hard or it doesn't make
Right.
sense or it's too much and you guys don't want to hear about it? Like tell me, so we really worked hand in hand on it. So really anyone could probably use it. It's just made it look pretty.
No, and I love it's so cute. Like you all, when you get a chance, definitely take a look at Dr. Shai's website and see it's the cutest cover. Like, and I'm into like all the pinks and all that. So I was just like, I'll just send
Exactly,
it.
right? Yeah. Yeah, so she picked the colors, she told me what colors she wanted it to
Right.
be, so that's kind of the color scheme. She was the CEO and approved
I
everything,
love it. She was like, my seal of approval. Yes, 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 yes.
Yes.
But I definitely wanted to, because I thought it was so beautiful. I also saw you had one for teens, but I was really excited to see the one for men, for Black men, because, and I'm probably butchering the slogan, so forgive me, but I love the fact that you were basically saying you're going to have all types of emotions. Like you could be sad, you could be,
Yes.
crying, laughing, all the things. And it's like, regardless of it all, we just want you to feel.
Yes.
That resonated with me so much, because I think of a lot of the Black men in my family and how they just have to always keep this like tough exterior, right?
Mhm.
Um,
Yes.
and I mean, as of late, I've seen like my brother, for instance, like he shows more emotion than he did, years
Mhm.
ago. But that was just like the thing. Like you just never showed emotion, you didn't cry, any of that. And the idea that you're giving them permission, I was just like, thank you. Because
Yes.
it's so needed, you know?
Yes. And that was definitely the goal. And I made that one obviously with the Black men in my life in mind, just like you
Mm,
did, right? So my husband, my son, my bonus son, my nephew, my dad, I'm like, what would be something that they could really pick up and use?
right.
And then also as another tool, because it is harder to get Black men to agree to therapy and agree to this and that. So I'm like, well, you start with the book, start with this at home, right? This can
Right.
be step one. Maybe you're not ready to go all the way out there, but just, the idea that we should be paying attention to these things.
Hmm.
I feel like that just goes a long way within itself. And like you said, the permission to just feel. I think, definitely as Black people and Black men, especially, that is something that's been taken from us. Like we just we're not even allowed to feel. Like we're
Right.
not even allowed to have the emotions that we have, whatever they are.
Mhm.
Where's the space for us to be human
Right.
and have those human emotions? This is a human experience and you have human emotions. And, we deserve to have those emotions and feelings too.
I love that. And it's so funny because I was just talking with a friend of mine, and he was mentioning he was, at work, and he was really upset. He's like, I had to watch myself because I didn't want, people to think, anything about me. And I was like, will we have the opportunity to express ourselves and it not present as
Yes.
this angry Black woman or this,
Yes.
aggressive Black man? No, I'm just upset. I'm a person that is upset.
Exactly. This happened. Humans would be upset about this. I am a human. And therefore, this is how I feel about it. What is so complicated about that?
Right.
And yes, and we see it everywhere. Like you said, it's at work, it's in our system. In our systems. Even in mental health. There's stigma, and the stigma is improving, like you said. So
Mm,
there's stigma, but even when we come to professionals, oftentimes the things that we experience and we say diagnosed the wrong way.
yeah.
We're given certain titles that are, not necessarily applicable, but the same presentation in two different people is interpreted a different way
Right.
based on the color of their skin.
Right. Exactly.
We see that all the time. So, which is another reason that I love doing the criminal justice and the forensic, because I'm like, who's there for us? There's too
Mm,
many of us on the inside, especially in California.
right.
But are the providers the same color as us? Are the people that are going out and doing these evaluations most of the time not?
Mm,
So I'm happy that I get to be, kind of a voice and be part of that solution that, we need to be on the inside too, because that's
mm,
where, we have large portions and population numbers there.
right.
So we need to be reflected in the people there that are helping them as well.
And you know what? Thank you so much for like doing that work, because like you said, it's like that representation is not there, and for people to like not see someone that looks like them or could possibly understand their
Yes.
experience, it's just like, okay, let me just get through this and just so I can
Yes.
just get back to whatever I was doing. But to really
Yes.
see someone and like kind of and have like some sense of like understanding of where you were and why certain things happen, that changes the game a lot.
Yes, it does. And Sometimes even in legal situations and stuff, it can change the game that you have someone that's really listening to what happened to you
Mm.
or your story or whatever. That could change how your legal case ends,
Wow.
as opposed to, we have no information. Nobody asked,
Mm.
or no
Right.
one even checked into it. We don't know. And so we're just going to treat you like a number, and here's the number of years you have now.
Wow.
Yeah.
My mind just like, it's mind blowing to me, but we know it's real, right? It's real.
Yes,
So,
absolutely.
oh my gosh, Dr. Shai, I could talk to you all day long. I'm serious. Like, this was so great. But please let
Yes,
everyone know where they can, one, get your books, your
yes,
journals, and then also I saw that you have like little affirming cards.
yes,
I was like,
yes. So that was my latest project, is affirmation cards, and that is definitely for the ladies. That was made
yes,
for the ladies. And even it's great for, teens, young girls, women of all ages, really.
right.
But yes, affirmation cards. Yes.
And I love that each card had a different Black woman on. That's like, yes,
Yes.
this is everything. I
Yes.
love it.
A representation, right?
Yes.
And again, that was another one. I use affirmations all the time. I've been using
Mm-hmm.
affirmations for years, and I'm a messy sticky note, uh,
Right.
torn up notebook, you know, toting around with me type person. Day I was like it would be cute if I had like some cards,
Right.
and I wasn't carrying around these ugly notebooks
Right.
and losing them, and had sticky notes posted on walls and things like that.
Right.
It would be great if I had something that was cute, and it ended up being okay. Well, I'll make some for everybody then.
I love it. They're so cute. I love it. So definitely. So yeah, let everyone know where they can get all the things because
Yes,
it's just beyond the journals at this point. So yeah, definitely
yes.
take it away.
So everything is on my website at drshaikay.com. So it's SHIKAY. It's like the middle of my name and the beginning of the last name, right? Because we have to shorten things up, right? Yes, and so everything is there. I have a lot of great items. My motto is kind of like therapy out the box.
Mm,
Like things have to be done in a non-traditional way because therapy was not made for us, and so we
yes,
have to figure out how to get the message out to us in a different way. So my whole thing is, like therapy outside the box. So it's different. It's not, traditional. It's probably not what you would expect to see. So, but it's fun, and it will get you to the next step.
I love that. Oh my gosh. And I will share Dr. Shai's information in the show notes. Thank you so much again for being on the podcast today. I learned a lot,
Thank
seriously.
you. No, thank you. I appreciate you having me. We had a great conversation. Thank you so much.
You are so welcome. Y'all, thank you so much for listening to this week's episode of the Eat Me podcast. I know y'all learned some stuff. All right, I'll see you next week. Thank you so much
Bye.
again. Bye.